Good afternoon, David Corner. I'm Mihiraa. Let's begin the warm-up session. What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It's always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult but also rewarding.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you could do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Your preparation time is over. Please start your OET speaking roleplay.
Good morning. I'm David Corner, one of the nurses here. It's lovely to see you and your little one today. Could you please tell me the reason for your visit?
Good morning, David. Yes, we are here for Emma's routine vaccination appointment today.
Thank you for letting me know. How may I address you?
You can call me Mihiraa.
Before we begin, I'd like to take a moment to confirm a few details. Could you please confirm Emma's age and vaccination history?
Yes, Emma is 2 years old now. She had all her vaccinations on schedule until her 18-month shots.
All right. Well, Mihiraa, do you have any specific concerns?
I'm a bit concerned about the need for this vaccination. What is the need for this?
Mihiraa, that's a very important question, and I truly appreciate you asking for more clarity on this. It's completely natural to have concerns, especially when it comes to your child's health. So let's talk a bit more about the why behind these vaccinations. The main purpose of these vaccines, like the ones Emma will be receiving today, is to act like a gentle shield for her little body. They're designed to protect her against some very serious and potentially life-threatening diseases. Think of illnesses like measles, which can cause severe rashes, and even pneumonia, mumps, which can lead to painful swelling and sometimes hearing loss, rubella, which is especially dangerous for pregnant women, meningitis, a serious infection of the brain and spinal cord, and polio, which can cause lifelong paralysis. These diseases can have severe complications, and tragically, some can even be fatal. The vaccines work by introducing a tiny, harmless part of the disease to Emma's immune system, allowing her body to learn how to fight it off before she ever encounters the actual illness. Now, regarding the need for vaccination, it's about building this strong defense before exposure to the disease. We want Emma's body to be ready and prepared to fight, so if she ever does come into contact with these viruses or bacteria, she's already built up immunity. It's much safer for her body to learn this way than to have to fight off a full-blown infection. And you might have heard the term herd immunity before, and that's also a crucial part of why vaccination is so important. When a large number of people in a community are vaccinated, it creates a protective barrier, making it much harder for these diseases to spread. This protects not only Emma and other vaccinated individuals, but also those who are too young to be vaccinated, like very young infants, or those who can't receive vaccines due to medical reasons. So, by vaccinating Emma, you're not only protecting her, but you're also contributing to the health and safety of our entire community.
That makes a lot more sense now. Thank you for explaining it. So, how is the process usually for a 2-year-old?
You are most welcome, Mihiraa. I'm really glad that explanation helped to clarify things. Now, regarding the process, it's typically a very quick injection, just a slight pinch that's over almost before they realize what's happening. Emma might cry for a moment, and that's perfectly normal, but it usually subsides very quickly. To help Emma feel as comfortable as possible during that moment, there are a few comforting techniques that often work wonders. We found that holding her close to you can be incredibly reassuring. Your presence and touch will be her biggest comfort. Also, distraction is a fantastic tool for this age. You can talk to her, sing a little song, or just try to shift her focus to something engaging. We'll work together to find what works best for her in that moment. Before we go ahead, just a couple more very important questions to make sure we have all the information about Emma. Could you please brief about Emma's current health status?
Of course. She's quite active and a healthy child. No known allergies, nothing. But nurse, what about the side effects? I'm quite worried about it.
You're right to be prepared for potential side effects, Mihiraa, and it's completely normal for children to experience them. The most common ones include a mild fever, soreness, redness, or swelling at the injection site, and sometimes a bit of irritability or fussiness. These are usually mild and resolve within a day or two. To manage these at home, you can give her children's paracetamol if needed for fever or discomfort, following the dosage instructions carefully. A cool, damp cloth applied to the injection site can help with any soreness, and offering her plenty of fluids will also keep her comfortable.
That's reassuring. I always worry about serious reactions, even though I know they're rare. My friend's child had a severe rash after a vaccine, and it just made me a bit nervous.
I completely understand your concern about serious reactions, Mihiraa. It's natural to feel that way, especially when you hear about others' experiences. I want to reassure you that vaccines undergo rigorous testing and are continuously monitored for safety, both before they are approved and after they are in use. Serious side effects, like the severe rash you mentioned, are extremely rare. The benefits of vaccination, in terms of protecting Emma from potentially devastating diseases, far outweigh the very small risks. Do you have any other concerns or questions before we proceed?
No, I think you've covered most of my questions. Just what should I look out for after we go home?
Excellent, Mihiraa. So for post-vaccination care, it's important to keep the injection site clean and dry. Avoid rubbing the area vigorously, as this can cause more soreness. Continue to observe Emma for any unusual symptoms over the next 24 to 48 hours. While rare, you should seek further medical advice immediately if she develops a very high fever, has difficulty breathing, develops a widespread rash, or if you notice any other concerning or unusual symptoms that worry you. You can either come back here or contact your family doctor or the emergency services if it's outside our hours.
Thank you for taking the time to explain everything so clearly. I feel much more comfortable now.
Finally, knowing all this and considering the benefits of protecting Emma from these serious diseases, do you give your consent for Emma's vaccinations today?
Yes, David, I do.
Thank you, Mihiraa, for the consent.